Okay, sorry for the mouthful of my title, but hello, everyone. Thank you for being here and taking time out of your day to listen to my presentation. My name is Mariam, and I'll be presenting on a rapid review of available Indigenous cultural safety policy tools in Canadian governments. So today I'm presenting from Treaty 6 territory in Amiskwaciy, also known as Edmonton, and the traditional territory of the Cree, the Dene, the Blackfoot, and also part of the Métis homelands. So a quick overview of what I'll be going over today. I'll start with acknowledgements and then an introduction, and then we'll move on to my practicum placement and project. And then we'll dive into a brief overview of cultural safety and policy. And then we'll move on to my rapid review and my findings, and then we'll wrap up with implications for Indigenous health. So first off, I'd like to acknowledge the many people who have guided and supported me throughout my practicum journey. Thank you to my practicum supervisor, Kyle Liu, and his supervisor, Mary Cameron, and also the entire Office of Indigenous Health team. I'd also like to thank my practicum professor, Dr. Victoria Barr, and our practicum coordinator, Betty Taylor. And finally, I'd like to acknowledge and thank the people who have been my strongest supporters, my family and my friends. So throughout my education in Indigenous health, I've learned the significance of introducing oneself and how it can give others a sense of our perspectives and where we come from, and also locate ourselves within the work that we do. So I'll share a bit about myself. My name is Mariam Ahmad, and I'm completing my MPH at UVic and in the Indigenous health stream. I'm a first-generation uninvited Pakistani settler, and I was born in Treaty 5 territory in the Palm, Manitoba, which is located on the traditional territories of the Anishinaabe, Oji Cree, Dakota, and Dene peoples. And I was raised in Treaty 8 territory in northern Alberta, which is the traditional territories of the Woodland Cree and Dene, and also a part of Métis homelands. And here are a few pictures of my family who I owe everything to. So I completed my practicum at the BC Ministry of Health within the Office of Indigenous Health. And the Office of Indigenous Health supports system transformation that promotes the health and wellness of all Indigenous peoples in BC. They also work with health system partners such as First Nations Health Authority to address systemic barriers in healthcare for Indigenous peoples. And my practicum project here was to develop an internal policy tool, a cultural safety policy tool. And the purpose of the tool is to support the ministry in implementing the government's commitments on reconciliation and cultural safety. All right. Now on to cultural safety in a policy context. So cultural safety in part is based on respectful, meaningful engagement with Indigenous peoples that recognizes and strives to disrupt power imbalances that are inherent in the health system. It also aims to develop an environment that's free of racism so that Indigenous peoples feel safe when receiving care. Cultural safety is also an ongoing process, and its efficacy is determined by the person that the policy impacts. In the context of cultural safety, it's Indigenous peoples. So cultural safety and policy is also a key piece of Canada's commitment to reconciliation, supported by the Truth and Reconciliation's calls to action and the United Nations Declaration on the Rights of Indigenous Peoples, or UNDRIP. Cultural safety also has significant impacts on Indigenous health. Culturally unsafe policies lead to inequitable access to services and relate to different health system utilization for Indigenous peoples, which has long and short-term effects on health. So compared to non-Indigenous peoples, Indigenous peoples' utilization rates of primary care and physician services were lower. However, hospitalization and emergency department utilization rates were higher. So from an equity-based and person-centered approach, strengthening cultural safety in policy is imperative, as it allows Indigenous peoples to access continuous, culturally safe care, therefore enhancing health and wellness outcomes. Embedding cultural safety in health policy is also essential to ensuring that Indigenous communities feel safe and are heard within health institutions and bureaucracies, and to be able to have their perspectives and knowledge centered in the policy development process. and ultimately receive the benefits of culturally safe policies. So more often than not, solutions and interventions aimed at reducing Indigenous health inequities have often focused on the individual and or community level, and they have been determined by seller organizations. And this is where they're vulnerable to systemic racism, which means that they're chronically underfunded or have inadequate infrastructure to facilitate productive interventions. Therefore, to facilitate cultural safety in a wider context, these interventions should also occur at a systems level. So for my culminating report, I wanted to research Indigenous cultural safety in Canadian health policy. So in this context, health policy are policies that impact the healthcare system. I wanted to first identify current policy frameworks used to embed Indigenous cultural safety in Canada. And secondly, determine if federal, provincial, and territorial governments, health ministries were utilizing any cultural safety lenses. So to answer these research questions, I conducted a short literature review that focused on grade literature, such as policies and frameworks for cultural safety in a Canadian context, as well as a jurisdictional scan to assess if ministries or departments of health were utilizing cultural safety policy tools. So the jurisdictional scan showed that most governments and their health ministries rely on gender-based analysis plus to embed cultural safety into their health policies. And the primary focus of GBA Plus is not cultural safety or Indigenous health, rather identity and social category factors such as socioeconomic status, gender identity, and ethnicity. So though indigeneity could fall under the ethnicity category, it analyzes indigeneity as one-dimensional, which isn't sufficient, as Indigenous people's health and experiences with health are influenced by many dimensions, such as the ongoing process of colonialism, intergenerational trauma, and systemic racism. The Gray Literature Search showed a limited availability of cultural safety specific policy tools. Most of the cultural safety tools were geared towards nurses and physicians and not policy. However, there were a few Indigenous specific GBA Plus tools and one recently released cultural safety assessment tool. So the Indigenous specific GBA Plus tools were developed by Indigenous women's organizations, specifically Paututit Inuit Women of Canada, Love Femme Michif Otipimsawak, and Native Women's Association of Canada. And these Indigenous specific GBA Plus tools are an important improvement to the non-specific GBA Plus tools, as they specify an Indigenous entry point that prioritizes the historical, cultural, and sociopolitical context needed to embed cultural safety into policy. By providing the context that shapes Indigenous health outcomes and inequities, the Indigenous specific tools account for Indigenous social determinants of health, which assists in facilitating cultural safety. The Cultural Safety and System Change Assessment Tool was recently released by Northern Health in 2021. So compared to the GBA Plus tools, the assessment tool emphasizes respectful, ongoing engagement rooted in reciprocal responsibility. Cultural safety requires processes that are entrenched in respectful engagement that seek to disrupt power imbalances in policy development. The tool also ensures that Indigenous cultural safety is centered at each step of the policy development process. So the lack of integration of cultural safety tools in Canadian health ministries has significant implications for Indigenous health. So first, the current lack of cultural safety policy tools integrated into ministries of health hinders the advancement of reconciliation significantly. All governments have committed to true and lasting reconciliation with Indigenous people through TRC's calls to action and the promise of adoption of UNDRA. Without these culturally safe policies, conditions that allow for health disparities for Indigenous peoples, such as institutional racism, will persist. And by embedding cultural safety into health policy, ministries of health can help advance reconciliation. Secondly, cultural safety is integral to improving and creating equitable policies that work with, for, and in service to Indigenous peoples, and ultimately improve Indigenous health status. With cultural safety, health policies can account for the ways that social determinants of health impact the health of Indigenous populations, which will hopefully lead to safer, equitable access to care. And finally, with the central aim of cultural safety being to improve the health and well-being of Indigenous peoples, adopting and implementing cultural safety in broader policy structures will support improving Indigenous health outcomes throughout the healthcare system. So in conclusion, to work towards eliminating Indigenous health inequities, embedding cultural safety into health policies is one key step to disrupting power imbalances that are inherent to the healthcare system, creating more equitable policies, and helping to improve Indigenous health outcomes. Thank you, and I'm ready for any questions you all have.